So basically, there are all kinds of different things that the dentist can use to kind of help improve their ability to deliver really good care. Certainly what I'm wearing, we call these surgical loops. They're essentially glasses with little microscopes on them, and certainly when we're looking on teeth, we know that teeth are very small, so the ability to find things is very difficult. So what we use is usually some sort of form of magnification in order to improve the access and visibility in the mouth. I have a lot of actually funny moments that I encounter, and it isn't kind of a one-time thing, but we see them all the time. Certainly one of the funniest ones that we deal with basically day in, day out is, when a patient has a lot of different things in their mouth, it's a lot more difficult to communicate to the dentist of what's going on, and we call that gibberish. And we see a lot of patients that try to talk, while we're working on them, and certainly trying to decipher the gibberish that they present with is always very comical, because even to this day, after several years of experience, it's still hard to decipher everything that they're trying to say. That's one funny moment that we encounter day in, day out. Certainly, when we're taking impressions, of people's teeth and gums, that can be a very messy scenario. So when a patient leaves, you may find that there's impression material that's still on their lips or in their nose or on their hair. And that can be funny because oftentimes we miss, somewhere where the material goes. And the other one that's often funny is when we use laughing gas. Laughing gas, again, relaxes the patient, but it also helps, release their inhibitions a little bit. So sometimes it's funny when a patient basically tells you things that you wouldn't normally ask, and basically with their inhibitions released, they tell you very, very unusual, funny things. Certainly when I spend a great deal of time with the patient, getting them out of pain or getting their mouth healthy to the way where they can smile and talk again, those are always very, very rewarding to me, whether or not the patient tells me or not. When I know that I've fixed their mouth to adequate health, that is certainly a very rewarding, experience. And we also see a lot of children, and I love to see children, walk out saying, hey, that wasn't that bad. That to me is a very rewarding experience because I've helped create kind of an ideal experience for the child and try to relieve, people of the stigma that, all dentists cause pain and all dentists hurt people, and that it doesn't always have to hurt when you go to the dentist. So those are all moments that are rewarding to me, not necessarily from a financial standpoint, but more of a patient being happy or pleased with the results.